We are going to get started. It is 7 o'clock, and I want to welcome everyone to our Zoom webinar. I am Dr. Rita McGuire, and on Tuesday evening, 7 o'clock Central Standard Time, we present the Doctor's Edition. We're going to talk about this evening, what is CBD? What do we use CBD for? How is it different from recreational and medical marijuana? So I'm one of the co-founders of Wakana, as well as the Chief Medical Officer, and I want to welcome all of our guests. We are streaming live on Facebook as well, so I want to welcome all of you to our presentation. So a little bit about me. I'm an obstetrician gynecologist of over 30 years. I trained at Wayne State School of Medicine. I completed my residency at Cook County here in Chicago as an obstetrician gynecologist. I'm the CEO of RJM Wellness and Ripped Rita Fitness. I'm a global women's health and wellness speaker, as well as a certifying physician for the medical marijuana program here in Illinois. I'm a member for Doctors for Cannabis Regulation, and of course, one of the co-founders and chief medical officer for Wakana. I also want to introduce you to the other members of our medical advisory board. We are made up of physicians, nurses, chiropractors, dentists, clinical psychologists, nurses, naturopaths, and we are excited to really bring and empower folks about CBD, how to use it, and to bring our expertise as well to the field. So let's talk about the difference between hemp and marijuana. Many of you have heard about marijuana, right? We know that marijuana is sourced from the cannabis plant. It's the part of the plant that gives us the high, the euphoria, the paranoia, and even the munchies. Now, marijuana has two main constituents or substances. One is delta-9 THC. That's the part that gives you the high. And the second is CBD and cannabidiol. We're going to be speaking a lot about CBD tonight. Now, there's another part of the cannabis plant called hemp. That's the other species. Now, hemp is different from marijuana in that it has very high levels of CBD or cannabidiol and very trace amounts of delta-9 THC. So hemp, though has the same constituents as marijuana, it has more CBD, so it gives you more of the health without the high. So both of these species are sourced from the cannabis family, but one gives you the high and one gives you the health, right? So let's talk a little bit more about CBD or cannabidiol. You know, cannabidiol has a very long list of medicinal benefits. The slide here, the writing or the words may be a little small, but just know that CBD has antibacterial properties. It also inhibits cancer cell growth. It is neuroprotective, meaning that nerves that may have been damaged from trauma or stroke or even chronic conditions like diabetes, CBD has been shown to help to protect these nerves. It also promotes bone growth. CBD reduces inflammation. It helps to reduce nausea and vomiting. A lot of oncologists and cancer treatments are using CBD to help those who are undergoing cancer treatments that may cause nausea and vomiting. CBD also helps to reduce pain and anxiety. It helps to reduce muscle spasms in those who have multiple sclerosis. It's vasorelaxant, meaning it can come in and help improve blood flow to very important structures, like those who may suffer from erectile dysfunction. or even hypertension, high blood pressure. There's other cannabinoids or constituents that the hemp species makes, and even the cannabis or marijuana species produces, that synergistically works with CBD to have an overall wellness to the body. Those constituents are CBG and CBC and CBN and Delta 8 THC, which is a new kid on the block, and even THCV. All of these cannabinoids, all of these constituents work in harmony to put the body into balance. Your next question may be, Dr. Rita, CBD legal? The answer is yes. In 2018, the Farm Bill was passed. And this was an agricultural bill, but it now removed hemp from the Schedule I drug listing. This is legal CBD, which is sourced from hemp, meaning that this hemp contains no more than 0.3% of THC, of Delta 9 THC. So in all 50 states, they've adopted this Farm Bill that legalizes CBD to be grown or cultivated, sold, and consumed in most states. So just know that because of the Farm Bill, now we've able to do research. We're able to do a lot of studies that will now allow us to look at CBD not only as a therapeutic option for our health, but absolutely an option for those who are looking for a more holistic way of addressing their health. So when we look at the science behind how CBD works, how cannabis works in the body, the science is there. And the science is called the human endocannabinoid system. You know, this system was discovered in the early 1990s when I was at Wayne State School of Medicine as a medical student. And though we didn't learn about this science, we do understand that it is the way that cannabis helps to put our body in balance. See, there are receptors throughout our entire body. As you can see on the right side of this slide, there are receptors found from our head to our toe that are looking for cannabis and cannabis constituents, or cannabinoids as we call it, to put our body in balance. They send signals to different areas of the brain, the heart, the liver, the lungs, the kidneys, the skin, the teeth, the stomach. All of these organs and glands in our bodies have certain receptor sites that are looking to attach to send a signal to reduce inflammation, or to reduce anxiety, or to reduce those muscle spasms, or to help to normalize blood sugar levels. So the main receptors are CB1 and CB2. So when we look at the endocannabinoid system, it's really a lock and key sort of system, where the cannabinoids like THC and CBD are the keys, and they lock into these receptors to cause a physiological response in our body. And our body also, like the plant, produces cannabinoids. They're called endogenous cannabinoids. In fact, in breast milk, you will find high levels of anandamide. Anandamide is the cannabinoid that our body produces that gives us joy, that gives us bliss. In fact, it comes from the Sanskrit word ananda, which means bliss, which means joy. So anandamide is analogous to THC, and 2-AG is analogous to CBD. So 2-AG is the endogenous cannabinoid that our body produces. It's also found in high levels in breast milk, that gives our body that relaxation, that gives the body the reduction in inflammation. So not only does the cannabis plant make cannabinoids, our own body produces endogenous cannabinoids that help put our body in balance. So cannabis, CBD, THC, they're all used for so many conditions and challenges like pain and anxiety and inflammation. In fact, you can see here that the number one reason that folks look and use CBD is for relaxation. They also look to use CBD for improvement in sleep, for relieving joint pain and offsetting nausea and helping to treat migraines and menstrual cramps and even sexual enhancement. So many reasons that folks are learning about CBD, they're learning about the endocannabinoid system, they're learning about the science behind how cannabis works in the body, and they're using it as another tool in the toolbox to give them relief. So let's look at drug testing. You know, we've talked about the fact that CBD is legal. By the Farm Bill, it's legal in all 50 states. Now, there's some states that didn't read the federal memo, but just know that in the majority of states, it's legal. But how about drug testing? Can I use CBD and still pass a random drug test at work? Well, we do know that the studies show that using CBD topically will not cause you to fail a urine drug screen. But how about other forms of CBD like gummies and tinctures and spices and other forms of smokables and vape cartridges? Well, there are certain sorts of products that you should look for that if you undergo random drug screens, you should use. And those are topical products, and those are CBD isolates and broad spectrum products. Products that contain less than 0.0% or less of THC, or those isolates that only contain CBD. In fact, one study showed that you would need very large amounts of what we call full spectrum products, those products that contain the legal limit of THC, which is 0.3% or less. You would need in upwards of doses of 1,000 to 2,000 milligrams to have an 11 to 23% chance of failing a drug screen. And so that's why it's really good that if you are undergoing random drug screens, that you can utilize either isolates, you can utilize broad spectrum products, and you can utilize topical products as well. So let's look at some of the number 1, 2, and 3 reasons that people look to use CBD and really how that works in the body. And number 1 is pain. You know, when we think about pain, pain can be pain that is sourced from peripheral nerves or central nervous system. So in the central nervous system, the brain, there are certain neurotransmitters that can facilitate or increase the transmission of pain. Those are glutamate pathway, substance P, serotonin, and then there's other neurotransmitters or pathways that generally inhibit or reduce the transmission of pain. You can see on the right side, opioids, right? Cannabinoids like CBD and other neurotransmitters like norepinephrine or dopamine. On the far left, you'll see the peripheral nervous system. When we talk about pain that is coming from peripheral nerves like sciatica or neuropathy, just know that the endocannabinoid system and with the receptor sites, they are binding to these receptor sites in the periphery, in the central nervous system, in the brain to reduce pain. And you can see here that these receptor sites that cannabis and cannabinoids bind to in the brain, like the cortex and the caudate nucleus and the basal ganglia and the hypothalamus, those CB1 and CB2 receptors that we spoke about earlier in the endocannabinoid system are the reason why CBD and other cannabinoids work for pain that is occurring or starting in the central nervous system. So the science is absolutely there on how CBD works in the body. In fact, there's a lot of studies that you can find in PubMed, you can find now at leading institutions, because CBD is legal, that shows how cannabinoids even manage difficult to treat pain that stems from autoimmune conditions like fibromyalgia and lupus, pain that stems from neuropathic pain or sciatica or neuropathy. So all the studies can be found now. Let's move on to number 2 reasons why people seek and use CBD. That's for anxiety and depression. So many of us have anxiety and depression. With this global pandemic that's going on, with all the things that are occurring, in our cities, with all the violence, we are looking for an alternative that we can seek for reduction of anxiety and depression. CBD works on receptors, again, in the brain that help to release neurotransmitters. Neurotransmitters like dopamine. Dopamine is a mood enhancer. CBD binds to those dopamine receptors in the brain to help release more dopamine. The same holds true for serotonin. CBD binds to serotonin receptors and helps more serotonin to be released in our system to help with sleep, to help with appetite, to help with mood, and just to help with our overall reduction in depression and anxiety. So the studies are there as well. Potential treatment, there's lots of studies that are going on using CBD, using cannabidiol for the treatment in anxiety disorders. So there are some things that you really should understand and know before buying a hemp-derived CBD oil. There's CBD everywhere. I'm sure you've seen CBD at gas stations, at smoke shops, but it's important to know that there are very, very big differences in CBD products. Not all CBD products are made alike. Where is the hemp grown? You want to source products that are, sourcing their hemp and growing it organically, making sure that the extraction process is clean. How you get the CBD oil out of the biomass is important. Is there third-party testing done on products? Is there a certificate of analysis that shows you the potency, ensuring that the product is free from mold, mildew, heavy metals, pesticides, and residual solvents? So what is inside the bottle is what matters most. And again, choosing a brand like Wakana, we're going to talk about some of our products that really stand behind their products. So here at Wakana, we have partnered with one of the top ISO labs in Florida, Green Scientific. They do all of our testing, all of our third-party validation. You can see I'm here with some of the scientific leaders, the chief scientific officer, and I'm telling you, they have state-of-the-art equipment. Their chromatography, their equipment for ensuring potency, ensuring that the product is free from mold, mildew, and heavy metals and residual solvents is something that's very important, because these are products that you are internalizing. So yes, all of our products come with certificates of analysis, ensuring not only the potency, like I said, but also ensuring that the product is safe and effective, being tested for mold and mildew. You know, when you give someone a product that they're ingesting and it has mold and mildew in it, that product could potentially make that person ill. So before we move on to our products, I want to read a disclaimer that the statements being made regarding these products have not been evaluated by the Food and Drug Administration. The efficacy of these products have not been confirmed by the FDA-approved research. These products are not intended to diagnose, treat, cure, or prevent any disease. All information presented here is not meant as a substitute for alternative to information from healthcare practitioners. So please consult with your healthcare professional about potential interactions or other possible complications before using any products. The Federal Food, Drug, and Cosmetic Act requires this notice. So let's talk about how much CBD do you need? Well, the Mayo Clinic did a study, and their study looked at dosing recommendations. And when they looked at those patients who had chronic pain, long-term pain, you know, those patients didn't need a lot of CBD. In fact, what they found was that the dosing recommendations were pretty low, between 2.5 and 20 milligrams of CBD with or without THC. When we look at even conditions, or the Mayo Clinic looked at conditions like glaucoma. Glaucoma was another condition where they found that no more than 20 to 40 milligrams of CBD is needed on a daily dose. Sleep disorders, multiple sclerosis, you know, epilepsy, loss of appetite, the dosing recommendation is start low, start slow until you find that sweet spot of where you're finding and looking for relief. So there's different ways of using and consuming CBD. One way is a tincture. A tincture is when you use the oil underneath the tongue. Again, starting low and slow, 3 drops twice a day is a really great way to start and use our tinctures. We also have 2 different product lines. We have a full spectrum line that I spoke of earlier, and that's our power products. Those are products that have the legal limit of THC, which is 0.3% or less. And then there's the pure or the broad spectrum line that contains less than 0.0% of THC. These are products that you can use if you have random drug screens at your job. And then there are edibles. You know, edibles are those gummies. They take between 30 and 90 minutes to get into the bloodstream. I meant to mention tinctures take about 15 to 20 minutes to get into the bloodstream. But edibles or gummies are another way to consume CBD, especially if you're looking for assistance for reduction in inflammation or to improve those symptoms that we see with sleep disorders, or if you're looking to have a product to assist with suppression or reduction in carbs or sugar cravings. We have a CBD coffee that helps to do that as well. So again, we have products that are full spectrum, our power products. We have our pure or our broad spectrum products that are in the white labels. And we also have products that truly address the immune and detoxification. We have teas, our bitter tea, our immune defense tea. We also have topical products. Topicals are another way to use CBD to give local relief for those sore muscles, those areas after working out, those areas that may be tight, you know, looking at our Extreme Power Pain Cream or our Dr. Rita's Rub is our topical product. We have products that address our face. You know, the skin is our largest organ on our body. We have a facial serum that addresses the reduction of inflammation in the skin, reduction of bacterial infections, acne, eczema, and psoriasis. And then there's smokables. Smokables are another way of getting CBD into the bloodstream pretty quickly. Smokables work within 1 to 5 minutes. So we have vape cartridges, we have pre-rolls, we even have a premium flower. Hair care. Now, hair and hair loss and alopecia is a global pandemic. We're seeing women and men all over the world that are losing their hair. Their hair is thinning from different hairstyles, traction alopecia, or maybe hormonal imbalances, androgenetic alopecia, or genetic hair loss or hair thinning. And then we have COVID, right? COVID infections, just the stress and trauma of having a COVID infection is causing hair loss and hair thinning. So we have a line called Save Our Strands, which we utilize CBD in a topical form to address our hair. Culinary products, products you can bake with, you can cook with. We have a vegan butter, we have a Culinary Plus, a product that you can bake and cook your favorite recipes. So there is a product for everyone. But more importantly, as we enter the new year, everyone is wanting to lose weight. We have products in a gummy form, in a coffee, a detox that really help to reduce cravings for sugar, reduce cravings for carbs, utilizing CBD to help you do that. CBD has been shown in research to turn white fat into brown fat. Brown fat is the fat that helps to increase the metabolism, to help to reduce the body fat, and to really help us to get in the best shape and the best version of ourselves. So really excited about our weight management system as well. So I want to thank you for taking this time out to really understand, a lot more about the science. And I think that's key to understand that there is science behind how CBD, how cannabis works in the body, and utilizing the species, the hemp species, to utilize CBD to be another tool in your toolbox to address our wellness in an organic, holistic way. And that is through our CBD products. So I'm going to stop sharing. This is my information. You can reach out to me at ritamd@wakana.com. That is my email. You can message me. You can really ask maybe some questions that you can't think of right now, but I'm going to stop sharing my screen to see if there are any questions in the chat box. If you're on Facebook Live, you absolutely can put your questions there as well. I'm going to check our chat box. I don't see any questions. Maybe that's a good thing that I did a great job this evening in making it very clear about CBD, its usage, the way it works in the body, and our product. In about 30 minutes, you can join us for an 8 o'clock business overview. If you were invited on the line, please connect with the person that invited you. And you may want to hop on the 8 o'clock call where you can hear more details about our product line, about our opportunity, and about all of our Black Friday sales that we have going on right now for the holiday. So if there's no other questions, I'm going to end it this evening. Have a great evening. Have an amazing holiday, and we will see you right back here next Tuesday evening at 7 p.m. Central Standard Time. It's Dr. Rita. We'll see you. Be well and be safe. And happy Thanksgiving.